What about non-surgical treatments for osteoarthritis? Can we expand on those?
Yes, you can use splints, topical anti-inflammatories. That's kind of Western medicine. Injections, both steroid, and we're now moving into using more amniotic fluid and those kinds of things. That hasn't really been tested well enough yet to know for sure whether that's going to help. But it does appear that it's going that direction. The other thing is, and I tell people this all the time, and they ask me because I have hereditary osteoarthritis. And so you can see the lumps in my fingers, and you can see that my thumb is slightly sublux there, and there's a good grind if somebody puts their finger there. And if you look at my x-rays, I look as bad as most of my patients. There's almost no cartilage, but I move beautifully. And so what's the trick there? And I tell them, you got to lose weight. You have to lose weight. Why? Because fat is its own entity. It's like an organ by itself, and it makes leptin and a number of other hormones and things that cause inflammation, and they directly attack cartilage and joints. If you can reduce the amount of fat that you're carrying, you will reduce the amount of inflammation of your joints. Who makes fat? Just like the TV ad, cortisol. Who's making the cortisol? The liver. Why? It's under stress. Toxic. So two simple things that you can do is go organic, but like a heart attack. And so in your food and in your skincare, because anything you put on your skin, it's in your bloodstream. So you really want to try and clean up everything you can in your diet and in your skincare. The second thing you want to do to lose weight is no pattern. Pick 5 styles of eating, 5 styles of exercise, mix it up every day. Don't do the same thing every day, because if you do, sure, that first 10 days, we've all done this. You lose your 10 to 20 pounds, you're like, wow, this is really working. And then bam, the door shuts. Why did it shut? You told your body you were heading into an ice age. And it says, I got to conserve every calorie for 20,000 years of extreme cold. And as Homo sapiens, we have about 5 interglacial ice ages memory in us. And with our Neanderthal genes, you had another 10, because they lived for 1 million years across the 39th parallel of Europe and into Mongolia. So that's our genetic lineage, and that's what you're telling it. Don't tell it that. And so mix it up, no pattern. And those things will help. And I've had many people come back to me and say, I thought you were a little woo-woo crazy, but I was so desperate, I tried. And darned if you're not right. And so it does work. If you can diminish the inflammation in your life, it will help you with your arthritis.